YouTube, is Rob from the Civic Report. I'm here with another article. I'm going to be pumping out as many as I can. I'm trying to limit my commentary unless I truly need to interject into something. I don't know what happened with my previous video. Maybe it was titled in a way that they didn't want, so they just messed with it. So I tried to rename it as close as I could. So anyway, here we go. This is from The Intercept. This is from Lee Fong. Head of health insurance giant Aetna slams Bernie Sanders' single-payer plan as lousy. The head of Aetna, the health insurance giant, not only slammed the gains being made in the push for universal Medicare, but also mocked its proponents as misguided. But in the process, Mark Bertolini got basic facts wrong about single-payer healthcare. Bertolini, the CEO of Aetna, the third largest health insurance company in the U.S., rejected the Medicare for All proposal released last week by Senator Bernie Sanders, independent from Vermont, and a group of 16 Senate Democrats. He at times used disparaging comments and outright falsehoods about neighboring countries' national health systems to criticize the plan. Bertolini, speaking at the Strategic Investor Initiative Conference in New York on Tuesday in response to a question from The Intercept, said that the Sanders single-payer bill does nothing to fix the underlying cost structure of the healthcare system. So if we refinance a lousy product, what do we get? A lousy result, Bertolini said. The Aetna CEO also ridiculed proponents of single-payer, suggesting that they are confused. Some supporters, Bertolini warned, are in fact talking about socializing all the hospitals and doctors. Everybody's going to work for the government. He asked a room of investors and analysts to name a country that has single payer. When several participants named Canada, Bertolini disputed the answer and claimed that Canada has a government run healthcare system. They're not single payer, they're single everything. Now, this is such a load of bullshit. Single payer is very, very simple to understand, and I'm going to explain it to you really quickly. Single payer just means if you are a U.S. citizen, the government says, I got you, man. I'll pay for your bill. It's that simple. There's no complexity. There's no what ifs, whatever. There's none of this nonsense about lines and socialism and all of this other crazy nonsense. It essentially is that. And these corporations, these health insurance companies, what they're doing is scaring people or using this stupid bullshit propaganda because if we implemented single payer in the US, these corporations will go out of business. So they're going to try to find in which way to scare the hell out of anybody so that way you can be scared and go with these stupid corporations where they don't even give you any kind of real health care. They do nothing. They're just this middleman. The thing you have to understand about health insurance companies are that they're just a payment system. That's all they are. They're just a payment system. So that means you pay them and then they go and pay the medical provider, whatever it is, the doctor, the hospital, the surgeons, the specialists, whatever the case is. And whatever the Aetna chooses not to want to pay for, well, you got to pay for the rest. Well, I'm sorry, I'm against that. If you're an American citizen and you need to go to the hospital, the doctor, the dentist, the eye doctor, whatever healthcare that you need, you just make an appointment, go to the doctor, and if the doctor gives you a prescription, you just take that little prescription, you take it to the pharmacy, and you get it filled and you walk the hell out. That's it. You in nowhere in the process of any of this, you pay for a bill. It's that simple. Now, if you're going to sit here and tell me how we're going to pay for it, real simple. The same way that the government pays for everything else. And if you still are wondering, well, how are we going to pay for it? Where are we going to get the money? Congress has the congressional approval to authorize any money to be spent on anything. It's that simple. There's no mystery. There's no spooky dooky anything. It's that simple. It's that simple. That's it. That's it. There's nothing else that I need to explain to this. That's all there is to the whole thing. And if you want to get scared about it, Please stop, because there's nothing to be scared of. It's just nothing but corporate narratives scaring the shit out of people because it's going to hurt them. They're going to eventually go out of business because the government is going to be the one paying the bill, because that's all a health insurance company is. They're just paying the bill. They're just this middleman. They're just this payment system. That's all they are. But why not have the government do it? They're way more efficient. They'll never run out of money. They're not going to deny you any kind of health care because you're the one that's going to go to the doctor, and then when they bill the government, they bill the government and the government just pays the bill. It's that simple. We don't run out of dollars. So just please stop. The suggestion, however, that Canada has a completely government-run healthcare system under which all medical professionals work for the government is false. In Canada, medical claims for virtually all non-dental healthcare are paid by the government, but doctors and hospitals work in the private sector. Oh yeah, and by the way, anywhere you read anywhere, I don't give a shit where the information comes from. If anybody sits here and says we got to raise taxes, well, you tell them, fuck you. We don't need to raise any taxes to implement Medicare for all. I don't even give a fuck if Bernie says that shit. I mean, I like the guy and everything, but if he's sitting here talking about we need to raise taxes in order to pass Medicare, he's fucking lying to you. Just like everybody else in Congress. Oh, we need to raise taxes. No, we don't. We don't fucking need to raise taxes to pass Medicare or to pay for Medicare. The government is the creator of the goddamn dollar. It's that simple. They don't need our fucking money to pay for shit. Anyway, Bertoloni appeared to be confusing single payer with a single provider system, such as the National Health Service in the UK, under which doctors and providers work directly for the government entity. That's not what Sanders is proposing. Under Sanders' bill, all Americans are incrementally enrolled into Medicare, and patients will be free to choose their private sector health care providers. The legislation also provides a range of cost-cutting measures, including provisions to lower drug prices. During his response to our question about the Sanders proposal, Bertoloni noted that he is a little infamous for this conversation, referencing a leaked recording of a company-wide discussion in April in which he appeared to signal openness to a debate over adopting single-payer. Immediately following the leak, Bertoloni moved to distance himself from the idea. There is nowhere in the Constitution that says we will need to provide people health care, he said shortly after the tape came out. I think government-run healthcare would be a bad idea because I think then you would end up with the central planning problem that has crushed the Soviet and Russian economies. See, there you go. This nonsense propaganda that it's just nothing but pure scaring people, saying communism and blah blah blah. What is the government saying to you as an American citizen? I got you, man. Don't worry about it. Just go to the doctor. It's not a big deal. There's nothing to be afraid of here. The private health insurance system has been particularly lucrative for companies like Aetna. During his talk, Bertoloni boasted that Aetna's stock price surged from $29.85 per share in November 2010 to $162 per share this week. His performance as CEO has also been handsomely rewarded. In 2016, he received a compensation package worth $41 million. The majority of Bertoloni's talk was centered on his work to stimulate better workplace practices at his company, from raising wages of the lowest paid Aetna employees to providing in-house yoga programs. Bertoloni has been praised for promoting employee wellness and corporate philanthropy programs at the health insurance giant, but the firm has also engaged in dubious political efforts. In 2012, Aetna inadvertently revealed that it funneled more than $7 million to GOP dark money campaign groups that specialize in electing Republicans without any disclosure of their donors. Bertoloni said the Aetna stock price was down yesterday over healthcare discussions in Congress, but he turned it into a joke. It's a good time to buy. Asked repeatedly by The Intercept if he supports or has an opinion on Graham Cassidy, the last-ditch Republican effort to repeal and replace the Affordable Care Act, Bertoloni demurred, noting he has no prediction on whether it would pass. Bertoloni is the latest healthcare CEO to voice concerns about the rising popularity of single-payer. As The Intercept reported, Brett Saunders, the chief executive of Allergan, worried that Americans are getting so fed up with the healthcare system they may one they embrace single payer. A number of lobbyists for other healthcare interests have also slammed the idea, claiming that the system proposed by Sanders is unworkable. So no, don't get caught into this bullshit, man. Just keep going, keep pushing. Hashtag Medicare for all. And this is Rob from the Civic Report. Take care. Peace.